have submitted today that I wanted to go through and just answer over YouTube and Facebook Live. So if you're here, you have more questions, just drop them in the chat and I'll hopefully get to them. But for now, here are the ones that were submitted. And so, first we have hello, Dr. Megan. For reference, I am a fairly healthy 58-year-old woman with a few age related issues, and the only med I take is Synthroid and a few supplements. After a week and a half of sinus congestion and inflammation, no infection, I saw a doctor and she prescribed the following: prednisone 20 milligrams twice daily for 5 days. I haven't started taking any yet due to concerns and questions. Around the same time, I went to the dentist for a toothache due to biting down too hard on a food item, and the dentist said I bruised the tooth or tissue, and he prescribed ibuprofen 400 milligrams 4 times a day for 3 days. Now I have two coexisting issues dealing with inflammation. In search of info and answers regarding prednisone versus ibuprofen for inflammation, I found your site and videos. Thank you. They're very helpful. However, I haven't begun taking either of the meds. Because of the following questions and concerns, I hope you will shine some light on, and I can decide the best course of action. From what I've gathered, it's not such a good idea to take both prednisone and ibuprofen at the same time due to possible effects on the heart, circulatory, and more. My blood pressure runs a bit high, so I'm pre-hypertensive. With that in mind, I have the following questions. Question 1, could only taking one of the meds, prednisone or ibuprofen, work to solve both of my inflammation issues at the same time? And if so, which one of the two would you recommend? The next question regarding the duration prescribed for each medication, which to me seems short and not considered long-term use for either one. When referring to the side effects, what can occur over time, what exactly is that time frame? And will any of the side effects from short-term use have long-term consequences? Thank you for your time and attention to my email. Sincerely, M. I didn't include her full name, just her first initial. So let's go through the first question she didn't even ask. And she kind of implied it, but my first issue is right here. Sinus congestion and inflammation, no infection. And they prescribed prednisone. So there is very little research showing that prednisone is effective for any form of sinus issues. I'm pulling up my website right now, and I'm going to copy and paste what is on my blog. Maybe I can figure out how to just share my blog. Let's see. Okay. All right. So my blog shows that this is what a doctor stated. They said it's important for the public to understand that most upper respiratory tract infections are self-limited. No intervention is required. They resolve on their own. If you don't seek care about 70% of the time, if you get an infection, it will go away without the doctor doing anything. And then we recommend not using systemic glucocorticoids. This means that steroids that go to your entire body when given in addition to antibiotics. Oral glucocorticoids may shorten the time to symptom resolution or improvement. And then basically there are the guidelines for sinus infections do not show that the pills are going to help at all. And she doesn't even have a full-blown infection. She just has inflammation. So I'm super concerned about this whole situation altogether. And then my next concern is, so basically, could taking only one of the meds work to solve both my problems? Yes. If all you did was take ibuprofen, I think that would be um, enough for both of the problems. And then which of the two I would say I would recommend ibuprofen because there's zero evidence that present prednisone is going to help. Like zero evidence that's going to help with that. So avoid this. Um, and the dose of the ibuprofen though, it was pretty low actually. It's only 400 milligrams. And so basically, if you're not getting relief at 400 milligrams, you could take up to 800 milligrams. That's the prescription strength of this medication. It all depends on, your hypertension and other complications, but 800 milligrams is the prescription strength. So that's a possibility. And then the duration is short. It's basically really your symptoms. Like, are you having relief? Great. Is it gone? Great. You can stop. Like, you do not need to continue taking it. Any of the side effects from short-term use have long-term consequences. So I'm hoping you're going to avoid prednisone, and so you're not going to have short-term side effects. But if you do choose to use them, there are short-term use side effects that have long-term consequences. Let me just show a very recent YouTube comment. She said, I was a thin, healthy dancer. I was given 60 milligrams of prednisone for 10 days, right? Like she only got 10 days. And it ruined my career, my body, and my life. Prednisone is definitely the hardest thing to recover from, especially because I basically hate myself. I'm a year and a half after, and my body's changed. My emotional pain is so great that I've stopped eating completely, so I faint a lot. Just kill me. That is from 10 days of prednisone. So, yeah, there are consequences that even just short term use. That's one possibility. You can have fractures. That's another possibility. But psychological, physical changes are real from short term. Okay. So that was the first question. Second question. Hi, hope you're well and I enjoy watching your YouTube videos. Wanted to ask your advice on what I must consider moving forward. I am 70 in fair health. I would be in good to great health if it wasn't for my RA, which stands for rheumatoid arthritis, which has not given me a moment since 2022. It has caused me to have congestive heart failure and anemia. The only time I have felt relief was when I was given a 5-day supply of prednisone a few years ago when I was taking your supplements. She's referring to Nutrinized Zone, the supplement that I invented to help people feel better while taking prednisone. She said, I recently had a blood infusion and they administered steroids with it. I felt human for 24 hours and now I'm grieving the loss of feeling like me. Oh, I have an appointment with my holistic primary care provider this next Wednesday and wanted to ask about going on prednisone full time. I am so worn out mentally and physically from every movement from head to toe being painful. Suggestions? What questions do I need to ask? B. So, a person with rheumatoid arthritis who finally feels like me while on prednisone is a real thing. I was at Harvard Medical School and the uh, the Harvard professor said, we all know that the guidelines say let's get our patients off of prednisone as soon as possible. Let's not keep people on it for life. But how many of you have a patient who's been on it for life? And every single rheumatologist raise their hands. And then other research shows that prednisone itself can help with preventing further damage from rheumatoid arthritis. So, um, it's really tricky because it prednisone itself can worsen heart disease and anemia, but it helps RA stop getting worse. It gives you relief. It makes you feel like yourself. And so it's a really tough situation with rheumatoid arthritis. But essentially there's a lot of debate in the rheumatology world and it bounces back and forth between is it safe for a person to be on prednisone for life or not? And essentially, it is every patient is different. And if you are so worn out and you're 70 years old, like, let's give you the rest of your life on earth time to be feeling good. Like, there's no reason for you to be grieving this loss. You need to be feeling good. You need to be on, like, if you were my mom, I'd say, yeah, go on prednisone full time. The goal here is back up to her, the lowest dose. You want to get on the lowest effective dose that makes it so you feel human, you're not worn out, you can actually move and not be in pain. There's no reason to have rheumatoid arthritis and be in pain. None. Like, there are so many medications, including prednisone, that allow you to have less pain. And so, talking to your doctor, you just say, hey, prednisone is the only time I feel relief. And I really need to try it again. Can you help me find the dose that gives me relief and doesn't um, have too many side effects? So, if you had an infusion, it probably had a pretty high dose of prednisone in it, but we want to keep you on a low dose. And so, what we're talking about is 2.5 to 5 milligrams per day, somewhere in that range. The lower, the better as far as ongoing side effects. So, if you can you work with your doctor and find where that dose is, then as long as you are taking my supplements to support your health to prevent further damage from the prednisone, this is a great strategy. Like, you have done what I wish everyone did. And that is look at the benefits and the risks. For you, the benefits are amazing. You feel human, you feel like me, you have pain relief. And then you are, like, grieving. Like, this is so hard for you to not be on it, knowing that there's this, like, quote, "magic pill." But you also know that it can cause damage, and that's why you took my supplements. And so when you find that balance of benefits and risks, then proceed. Like, it's okay to be on prednisone long term. It's okay. So just talk to your doctor. Download my prednisone checklist. Make sure that you have a plan for all of the things in my prednisone checklist. Let me include that. I'm pretty sure you've already downloaded this because you're on my email list. But if anybody's watching this and hasn't downloaded it, get this prednisone checklist and it will include all the things to talk to your doctor about. Um, so okay, I've missed a few comments. Let me get to those. Surviving Medicine said, these doctors are crazy. And yes, I totally agree that the doctors of this person are crazy. Okay. Switch off the adrenals and screw up the HPA axis. Yes, that's what prednisone can do. Yeah, we should make a complaint to the practice about recommending prednisone for a sinus infection. Like, no, this is not appropriate ever. Okay. And then thank you for all these comments, Surviving Medicine 001. I'm really enjoying them. Okay. So I'm just laughing about this one. All right. I'm going to scroll back down to this question here. B's question. So I feel like we've covered, like, the main important things you need to know to discuss with your doctor. And the big takeaway is get on the lowest effective dose and then download my prednisone checklist to make sure you're covering all those things with your doctor. Okay, we have June and Onb says, I was on 40 milligrams for a year for severe RA. It caused the need to go on gabapentin for the side effects. That is the worst part about prednisone, is that it causes you to go on other medications to deal with the side effects. But holy cow, 40 milligrams is a gigantic dose for a year for RA. Like, that is huge to be on for a year. It sounds like your RA must have been horrific if your doctor kept you on that high of a dose. Like, horrific. Okay, and then you continue to say, I'm also a gastric sleeve patient. The prednisone caused severe weight gain, and I haven't changed my bariatric diet at all. Yeah, prednisone is truly remarkable, and how much weight gain it can cause. Wow, that is really tough. Okay, Mr. Music Addiction says, I was on it for more than 10 years as a kid, every day. That is a long time. I pronounced your name correctly. Yay, I'm glad I pronounced it. Oh, good. And you were wheelchair bound? You know what? I've spent 6 months of my life in a wheelchair, so I understand that too. I crushed my heel bone and I've had 4 surgeries to fix it, and every time they say I'm no weight bearing, so 6 months of my life in a wheelchair. Okay, and then we have, let's see, Muhammad says, I've been taking 5 milligrams of prednisone for RA for 8 months. My doctor tapered it from 10 milligrams. I'm just 25 years old. I cannot do any heavy exercise. When I do any physical exertion, I feel very tired. I hear you. That is really tough being a 25-year-old who can't exert yourself. Like, you're supposed to be young and strong. This is your chance. I'm sorry about that. Oh, wait. And then Mohammed continues to say, prednisone 5 milligrams giving me skin fungal infections, and it's making my skin very thin. I'm just fit 25. Wow. Well, hopefully someday you'll be able to get off of it, and the thin skinning will go away. If you get stretch marks, those don't go away, but thin skinning can go away. And then skin fungal infections. I don't even know how to answer that. That is so hard. Oh, okay. And then Junan says, it's been 14 weeks since you tapered. So sorry you hurt my foot. Thank you. It's been 10 years since I originally injured it. So still getting physical therapy to this day, but I can walk, and that's what matters. Surviving Medicine says, does high dose prednisone leave a permanent catabolic signal in tenocytes, the tendon cells, or is it just a lag in repair? I have widespread crepitus and subluxation 18 months post dose. Wow. I'm not that deep into the science of tenocytes. I don't know that specifically, but the catabolic effect of prednisone does usually recover. It does take a while. But if you've got the subluxation and crepitus, I'm wondering if there's some other situation going on that isn't prednisone that, I can't diagnose over YouTube comments, but talking to doctors, like, that could be another entirely different situation that has nothing to do with prednisone. What supplements specifically turn off the MMP enzymes that eat collagen and switch the body back into anabolic tendon repair mode? I don't know any that specifically turn off NMP enzymes, but generally, supporting your collagen intake is a great idea. Eating good protein, taking a collagen supplement, those are good ideas. But I don't know anything that does that. Mr. Music Addiction said, I had a cocktail of steroids, allergic meds, and inhaler, and I'm beautiful. Yes. That sounds like asthma. That does sound like asthma. Juhan says, do you think my metabolism will go back? Yes, I do. I lost 237 pounds. Gaining 50 pounds is catastrophic for my mind and illness. So, whoa, except I meant to go here. Wow, you guys, the comments are coming in too fast. I can't keep up. Junan says, I have a new rheumatologist, but she isn't in sync with my other specialists. So that is a tricky situation when your doctors aren't talking to each other. And bringing notes from the other doctors, like the brief, like, paragraph from a previous doctor, can help when you have an appointment with them. But getting doctors to communicate to each other is a whole systemic healthcare system problem. I totally agree, is a giant problem. So, back to, do you think my metabolism go back? Yes. Prednisone weight gain is not a permanent complication. Is not like the changes your body that happen to your body because of prednisone, as far as your metabolism, are generally not permanent. Like, if you get steroid-induced diabetes, it is usually reversible. If you get steroid-induced weight gain, it is usually reversible. It's not immediate. It takes time, it takes work, it takes all the things, but it happens, and I am so excited. At the end of this month, I have, like, a full-on prednisone weight gain series that's coming out, so watch out for that coming. I've got 3 back-to-back marathons. Step 1 of this marathon is, like, how prednisone causes a weight gain. Step 2 is what to do about it, and step 3 are, like, interviews I've done with people who actually overcame it, and so it's, like, motivational. And then I also have an interview with a weight medicine triple board certified medical doctor, and I'm so excited because she dives deep into all things metabolism, weight gain, all of that. So, like, that's coming end of the month. Look for it. When Christmas is over, I'm going full blown prednisone weight gain mode. Okay, let's see. Bab says, I did rituximab 4 weeks for EGPA. Now being immunosuppressed, I have infection. My expectations of starting to taper prednisone 360 milligrams daily for 18 months is delayed now. Do you know why? Okay, so I personally did rituximab for 4 weeks for my disease, which is not EGPA. I have ITP. Let's see. Your expectations of starting to taper is delayed. I don't know why it would be delayed. That is a surprise to me. I don't know why that would be. Um, did the rituximab help at all for the EGPA? Because when I use rituximab for my situation, it was kind of like, this will either work for you and help, or it will not. And there was like a rarely an in between. And thankfully it worked for me. And so if it didn't work, that might be why it's being delayed. But seriously, that is such a big dose for 18 months. Holy cow, Babs. Okay. Mr. Music Addiction said it made me gain a lot of weight, but definitely had side effects. But it definitely had side effects on me. I'm lucky I cured my asthma and got off it at 17. But from 7 to 17, I took it every day, twice a year. I was in the ER, I had pneumonia. That is some terrible asthma you had. I'm so sorry. Junan says, you are a godsend, Dr. Megan. Oh, thank you. Mr. Music said, and bronchitis a few times, but pneumonia was every year for me. That is horrific. Okay, Junan says she's also on methotrexate and Humira from Rimvoq. So those are all great drugs to be on for those situations. Primary said the weight gain could take a year to go back if ever. I agree. It might take that long. It really might. Like, that is definitely a thing that might take a year. And then you share all my videos. Thank you, Junan. Bab says, I suggest making a folder, whether printed or on an app. Start with the beginning of your disease with dates, treatments, docs, seen, tests, and doctors, and take with you to each doctor appointment. That's a great tip, Babs. Thank you. This, I totally agree with us. Also, a list of questions you want answered at doctor's appointments. Definitely. What I personally do when I have doctor's appointments, and I put it on my Google Calendar, and then in the description section of my doctor's appointment, I start at like listing questions. And then when I'm there at the doctor's office, I can just open my Google Doc or my Google Calendar appointment, and it's there. It's so easy. Okay, let's hit the likes for the doc. Thanks, guys. Merry Christmas to us. Yes, once Christmas is over, the weight gain series is coming. Thank you for my vibe. Okay, I'm not sure. I thought I answered your comments. I talked about I've literally talked about every single. Oh, this is the one I haven't gotten to. Sorry. Is it dangerous to be on 5 milligrams for RA? So yes and no. 5 milligrams is like a pretty lowish kind of dose. And usually it's kind of the point at which the benefits usually outweigh the risks for most people with rheumatoid arthritis. Above 5 milligrams and the side effects are like overcome the benefits. And below 5 milligrams, the benefits start overcoming the side effects. So if you can be on 5 milligrams or below with rheumatoid arthritis, then that's the safer strategy. I'm not going to call it safe, but it's like safer. Oh, I love this. Can I just say my pharmacist saved my life 3 times? Doctors should be pharmacists before med school. Yes. Or they should have a pharmacist double check everything they do. Oh, wait, that's what a prescription is for. Yes. Talk to your pharmacist. People like your pharmacist is required to counsel you. And if you, and then when they say, do you have any questions for the pharmacist? And you say no, like you're wasting your chance to get free medical advice. Like you paid for it with your prescription. So get it. Like talk to them. Okay. Jay Chang. My question is off topic, but what do you practice at home for healthy habits? Thank you. All right, Jay, you really want to know? Step 1, if I had my camera on, you'd see me drinking from my water. I basically only drink water. That is the thing. I only drink water. I drink it from a stainless steel container. I drink a lot of water. So that's the first thing I do. I try to get 5,000 steps every day. I try to do push-ups and other weight-bearing exercises to keep my body strong. I try to get 8 hours of sleep by turning off my phone early at night. Basically, if you download my prednisone checklist right here, let's see. The stuff on here, I include it because I do it. Like I'm basically going through the things that you should be doing while on prednisone, the healthy habits you should be doing. You should be getting good sleep. You should be turning your phone off. You should be getting as much walking and exercises as safe for your condition. You should be eating lots of vegetables and protein and avoiding sugar. That is my biggest not healthy habit is I live with a lot of children. And they bring home lots of sweet things, and they also like to bake sweet things, and so I enjoy that with my children. But the other things I feel like I've optimized for my health. Okay. Jay said, "So different request. Would like to see our doctor face to face too." Haha. I call my pharmacist before I take anything. Yes. Awesome water. Okay. What about your mind? Okay, I'm getting like a junk spam call. I have to like stop it. Turn off. Okay. Do you guys hate spam? I hate spam calls. They're so annoying. Okay. Jay says, what about for your mind? Okay. So for my, come on, share. Okay. For my mind. So I turn my phone off before bed. And that is one thing that really helps me. Like I'm only using like real books after that, like real hard copy of like notebooks and physical books after an hour before bedtime. And then first thing in the morning, I do a headspace meditation every day. And that really helps me clear my mind, ground my emotions, get centered. And so, yeah, I meditate every day. Okay. Junan says, I would love to sleep, but pain stops it. That is the worst thing. It's like, okay, I need sleep so that my body can recover, but also I can't sleep because I have pain. And so then I take the medicine that causes me to not sleep, but I'm not having pain. It is a terrible vicious cycle, the pain and the prednisone and the sleep. It's Gladys Official says, my daughter has been on prednisone for 2.5 months and the body changes affected her confidence. She's tapering and can't wait for her to get back to normal. Yes, exactly. And one thing that can really help her recover is my supplement, Nutrinize Zone. It is designed to help reduce your suffering and help replenish the nutrients so that you can recover from taking prednisone, get back to looking like yourself again, feeling like yourself again. So you just get it on Amazon or on my website, either way, and it is exactly what you need to recover. Okay. Thank you, Junan. You didn't expect meditation? Why not? Like meditation is literally like life changing. Everybody should be meditating. Okay. Sleep is a game changer. I recommend a sleep mask and blue light blocking glasses. Ooh, yes. I forgot to mention those things. I use a sleep mask every night. I use blue light blocking glasses if I need to use a device after sunset. Can you take my supplement as a bariatric patient? I checked this out for another patient and it was fine, but definitely discuss it with your doctor. Um, some people's situation is more complicated than I'm aware of. So, as far as bariatric itself, it was fine. But I don't want to give a blanket statement that I can't defend. You should definitely talk to your doctor and make sure. But Nutrinizone is exactly my best support. Oh, yes, prayers too, a form of meditation for me. And amen. I pray morning and night and in between every meal. I feel like it also helps ground me. I pray. There's actually studies showing that people who like say grace or say prayers before meals, it really helps you digest better. It's like really surprising, but I think it goes back to the science of prednisone. So prednisone is basically putting your body in the fight or flight sympathetic mode all the time. And most of my tips that I just shared are helping your body go into parasympathetic mode, which is rest and digest. And when you pray before a meal, like you take a deep breath, you feel grateful, you're like slowing down. That helps your body convert from this fight or flight, I'm barely surviving mode to resting, digesting. So, yeah, it is super helpful for improving just even digestion, your ability to absorb food better. Okay. Surviving Medicine says any advice to deal with doctors that gaslight you about side effects not being possible on, say, a 2-week course at 50 milligrams. The whole GB practice supports this. Anything we can direct them to. Oh, yes, you should go to my website. So what is super fascinating, I'm not savvy enough with this. Maybe I can figure it out. Let me try sharing a different screen. Let me try. I'm going to replace my screen sharing with my website. Let's see if it'll work. Ha! It's working. Okay, so let me take you to my website and I will drop the link to it so you can see exactly what page you can take them to. So if you go to my blog and you see the prednisone side effects, the ultimate list. And the reason I can call it the ultimate list is truly fascinating. So when I look at one, so like here's a ton of them. Actually, before I dive into why, I'll just show you how to use it. So close that. All right. So basically, there's the category of the side effect, the actual like medical name of the side effect, the common name that I just translated it into like normal English, and the source. That's where it's going to get interesting. The frequency, like if they mention how common it is, and then the dose where you'll expect it. And so you can type in the search bar like sleep. So neurological can't sleep. It's listed by these sources. So here's the sources, and they're all evidence based. They're like the highest quality your doctor will respect every single one of these. Like these are all what your doctor is using for their medical information. Okay. Like most doctors have a subscription to Up to Date. Many of them, most pharmacists have a subscription to at least one of these databases at the very minimum. I'll make it a little better, bigger so you can see it better. Most pharmacists have these. Doctors usually do too. This is the FDA's package insert itself, and this is the Natural Medicines database. We may not have heard that, but anyway, so essentially, I was completely stunned to find out that there is no complete list of prednisone side effects. And the reason is probably because prednisone's been around forever. FDA approved it in 1955, and that was before they required side effect testing. So the drug company itself never published this information. Okay. So I'm going to hide the thing. Okay. So you can see better. Um, so, like, this is what a new drug would show, like, all of this very detailed information, right? But prednisone's super old, and so if you go to a free search, it'll show this super weird image, including psychic disorders. Do you see that? It says psychic disorders. I'm pretty sure prednisone is not going to suddenly make you be able to either read people's minds or predict the future. Like, that is just so completely inaccurate and wrong. Like, it is I can't even get over how wrong this is. Psychic disorders. Oh my heavens. And then of these side effects, which some of them are real, aside from psychic disorders, prednisone weight gain is not even on there. Like, what in the world? So weird. So basically, what I did is I looked at all of those different resources I mentioned that are all super well respected by the doctors. They're evidence based. Like, it doesn't get any better than that. Okay. And I took LexiComp, clinical pharmacology, micromedics, and then I spat out all the group terms and then like things that were kind of overlapping similar. I called like the English simple version high cholesterol. Okay. And so this is what completely stunned me. I'm going to try to make this even bigger so you can see it. Every single reference from up to date to clinical pharmacology to lexicon to micromedics, like all of these super well respected drug references had different lists of side effects. Like, can I say that another way? They don't have the same information. They don't tell the same story when it comes to prednisone. They are all different. So if your doctor is only paying for a subscription to up to date, they're not getting any of this information. None of it. If your doctor only has a subscription to clinical pharmacology, they're not getting any of this information. And it's even worse when we're looking at micromedics, which is one of the most common ones. Look at 13, 16, 14, 11. They don't have all of that information. It's not included in what your doctor is looking at. So basically, if you like think of how like social media is so the algorithm like puts people in echo chambers of bad information, like politically or whatever, and how like for example, like maybe these are like Republicans leaning posts and these are Democrat leaning posts, and how like they're seeing this information over and over again. And the Republicans are seeing this information over and over again. And they're never ever seeing the other information that might change their mind. That is what is happening with your doctor. Like, your doctor doesn't know because there's no good list. And so the only good list is my list. And I said I would drop it in the chat and I never did. Here is the best, the ultimate list of side effects. Here I am typing it into the chat. Okay, there it is. That is the ultimate list of prednisone side effects. You can share that with your doctor, and it's all evidence-based. I didn't make up any of it. And it's because the drug is so old, the lists are all different. And so if you're being gaslighted, it's not your doctor's fault. They don't even know. Or they or this. I don't think my doctor has any subscription. LOL, just zero knowledge on it. Also a thing. Like, that's also a thing. The education of doctors when it comes to prednisone is not what I wish it was. I wish it was better. I actually had a chance to take a job teaching medical students, and I wish I could have accepted that job, but they just wouldn't pay enough to justify me being away from my family that long. And I wish I could just teach about prednisone. I wish I could just go back and be like, hey, can I just teach this one class period, please? Because they have zero knowledge on it and like they just don't know enough. It's really tough. Okay. Pig farm equals population control. I went there. Psychic disorders makes you feel like I want to take them and get superpowers. Yes, that is fantastic. Yeah, that's not real. That is fake news. It's not an actual thing. Okay, yes, this is a real thing too. Did I mention I suffer from bipolar disorder and schizophrenia? It exacerbated all of that too. So if we go back up to my ultimate list and we search the list right here and we go schizo. Here we go. Neurological side effects, psychotic disorder, psychosis, schizophrenic reactions, mania, hypomania, hallucinations, delirium. And I just call that you feel crazy. Like it totally changes your brain. And guess how many of those sources mention this? All 5. And if you're taking over 75 milligrams, 30% of people are going to experience this. So it's not just you. Like it's real and it's more common the higher the dose. So that's totally legitimate. Not your fault. It just is what prednisone does. Okay. Mohammed says, please make a video on prednisone and male sex hormones, why this drug destroys our relationships. Guess what? I've already done that. Let me point you in the right direction, Mohammed. Male. Just go to my website, prednisonepharmacist.com, type in the word male, and let's see. I have so many articles. Here we go. Prednisone side effects in men. So I'm going to drop this in the chat for you, and you can read more in depth. But there's a video here you can watch, and it all goes to the fact that I'll bet to most of you, these pictures all look almost exactly the same. If you're playing that game, like how are these different? They're only different by like a tiny little bit of like a few molecules different. So prednisone is mimicking cortisol and it's almost, and then testosterone is the bottom middle one. They're really, really similar and your body can switch in between them. And so, yeah, it's real. Okay. Have I ever heard of Joe Dispenza? Yes, I have. What did you want me to know about Joe Dispenza? Like, why did you suddenly think of that? Surviving Medicine said I had hallucinations at 50 milligrams. It's real. It's so real. And voices for 2 weeks. Yeah. Doctors need to do this work. Yes. And doctors don't care. Also, they're overwhelmed. They are so like they are just cogs in the wheel at this point, and it's not their fault that they are so burned out with so many issues. It's just so wrong how the system is treating doctors these days. Oh, thank you, Junan. I'm sending love and prayers to all of us in Dr. Megan and family. Thank you. We sure need it. Everyone needs prayers. So go send some prayers. Merry Christmas, everyone. I think that's a good way to end this today. So thanks everyone for joining me. And if this was helpful for you, make sure you subscribe, share this with anyone you think of that can help, and then be sure to try out Neutronized Zone because it's going to help you while on prednisone. It's exactly what prednisone depletes, all put into a capsule to help you reduce your suffering, replenish your nutrients, and recover from taking prednisone.